Hi everybody, we are back. Today we are going to talk about things that affect our babies after they are born, but things that occurred during pregnancy, things that we could have prevented if we knew how to. So I know some mummies might know, some might not know. I'm not sure, but I just want everybody to be in the same level so that we protect these babies. We make sure they lead a healthy life until they are able to take care of themselves, right? Okay, today we are going to talk about a common, rather, it's not common per se, but it does happen, hey? It does happen a lot. So I don't know how to classify it, but I've seen it a lot. A condition that happens in neonate called necrotizing enterocolitis. This is whereby the intestines of the baby inside they start rotting, rather, if I can say, but rather dying, like inside it start losing function. Anything that is necrotizing, something that is dead. So all those things. And then it is mainly pointed on the children, or rather babies who are born prematurely. It's common on those ones, and some that are having a very low birth weight of less than 1,500 grams, if you can say 1.5 kgs to make it easier for you to follow. Yes, but it does happen even on 10 babies sometimes, even though it is not common on 10 babies. So the necrotizing enterocolitis, it's mainly due to the many differences that are called, many reasons caused by infection, neonatal sepsis to be specific. And these infections, most of them are carried from pregnancy, and these are classified as early neonatal sepsis. These are infections that happen, like the chorioamnionitis. That is an infection of your membranes during pregnancy, and also things like urinal tract infection that cause the ascending of the pathogen into the baby, into the placenta. Then it gets transmitted to the baby via the placenta. And also, if your membranes, or rather your water break, we say the membrane rupture spontaneously, but to make it easier for you to follow, if your water break early, very early, and then you don't come and report immediately, you stay long, and then when you start feeling pain, now that's where you start, no, you shouldn't be doing that, because this thing, if ever your water stays broken for a long time, mostly 18 hours before birth, you are standing a high chance of developing this infection that is going to cause the early neonatal infection on your baby. And the list is endless. So to prevent such problems is to make sure that during your antenatal period, you report any kind of infection. If you've got a fever of unknown cause, like you find yourself, man, I'm feeling feverish, I'm feeling hot, and then sometimes it even cause, especially the chorioamnionitis, it even cause the very same premature birth that is going to make your baby born before the correct time, and can also cause your baby to be born with a weight that is less than the 1.5 kg. And then if now you don't breastfeed, because it's common in babies who are either mixed fed or formula fed, because you are not going to be accurate at all times with the feeds, because you don't know exactly how much does the baby want. You can also estimate according to what is written on the formula, but you really don't know how much the baby wants, of which if you breastfeed exclusively, the breast is designated for the child, so there is no way you can overfeed with that. So if ever you are mixed feeding, or you have the baby develops neonatal sepsis from the pregnancy problems, like pregnancy infections that I've mentioned above, the baby is at risk of developing this necrotizing enterocolitis, which is killing our babies. Sometimes it's not an early neonatal sepsis, it can be the late one. That is when the baby has grown now up to more than 7 days. Sometimes you can say from 4 days, but It's mostly said to be after 7 days. So all those infections that the baby can get can end up with the very same condition. So if you give your baby breast milk, this is mainly to encourage you to breastfeed. Your baby does not only gain weight properly and get safe, healthy food that has all the ingredients it needs, she or he needs, but you also giving a good immune system to this baby. You are preventing common respiratory tract infections that occur in neonatal life. Your baby gets to be protected from that because you are encouraging them to grow. And then you don't just breastfeed when you feel like. You breastfeed on demand. Whenever the baby wants to drink, you breastfeed until the baby is satisfied. Please don't put the baby on the breast for 5 minutes and then you say the baby is breastfeeding. That baby is not going to get enough food, and then it start developing complications of insufficient breastfeeding like jaundice. And then jaundice is the boss of problems. You start developing infections, we go back to the necrotizing enterocolitis, which end up killing the baby. We also get complications like what we call kernicterus, that is the penetration of the jaundice, the yellow color, into the brain, which is causing the brain problems that can lead to what we call cerebral palsy. I'm sure you have seen a lot of babies who have cerebral palsy. Those babies, they don't grow well. They don't develop like other babies. They end up being a full dependent of the parent until forever. So it's important to protect our babies. Even prematurity is another culprit to cause the very cerebral palsy. So it's important to make sure that whenever you feel something you are not sure about, you quickly go and report it to the facility where you attend your antenatal care. If it's with us, you come, we give you to the gynecologist, whereby you're going to get the prescription. Or if you are not using a gynecologist, you rather go to the local clinic where you're going to get the prescription of the antibiotics so that you are able to treat these infections before they cause problems. So please, the objective of this video is to encourage breastfeeding. Breast milk has lots and lots of benefits. I've just mentioned a few, but I'm telling you it's a lot, starting from you as a mother, because it helps your uterus to contract much quicker, because as the baby sucks, you're stimulating your brain to produce a hormone called oxytocin, which is helping your uterus to go back to the pre-pregnancy state. So you lose your big tummy at a higher rate than if you were not breastfeeding. And you are also preventing problems like clotting factors when you breastfeed. And then you also prevent bleeding, hemorrhage, which is happening when your uterus is now not getting the tone that is strong enough to control bleeding, and then you start getting the postpartum hemorrhage. So you are saving yourself the trouble from such problems. You are saving yourself from staying long with the lax uterus and the muscles. You are also helping your baby to get a good immune system that is preventing all the infections that happen in neonatal life. You are also saving your baby from developing all these diarrhea kind of things that happen, because sometimes some babies don't tolerate this milk well, and then it start bruising their stomach lining. Remember, it's still immature. Even if it's a term baby, GIT, those intestines are not yet strong enough to stand the harshness of whatever feeds we give them. That is why it's very important to be breastfeeding exclusively until 6 months. As much as it is okay to start introducing feeds at 4 months, but mixing with the milk, at least there they have started developing. But the highly recommended period is 6 months. That's when you can start introducing feeds. You are not stopping breastfeeding, you are simply starting to introduce feeds. Okay, now you are worried, I'm HIV positive, I'm worried, am I not going to infect this baby? No. What you have to do is to make sure that you control your viral load and make it as low as undetectable during pregnancy. As much as we prevent it even after, but it starts during pregnancy. That is another reason you must consult and start antenatal care as soon as possible, so that they can take blood for viral loads and the CD4, so that we see if ever your immune system is good and how much CD4 count do you I mean, what you call your viral load do you have, and then you are given a medication that is going to help you to take down. And if there is another infection that is making it difficult to control your viral load, like co-infections you didn't know about, maybe a TB that we haven't noticed, or a pneumonia, you are going to be referred properly to the correct doctors that are going to treat you, and then you are able to control the virus, that you are not transmitting it to the baby. And then after delivery, the baby is going to be tested and given an nevirapine to make sure that you prevent the cross-infection from the virus. And if ever your immune system is good, you are having a high CD4 count and the low viral load, you are not going to transmit the virus. It is well controlled. You are able to breastfeed exclusively until your full 6 months without infecting your baby, and you are going to be ascertained that your baby has not got the infection, because you are going to be done the PCR at birth, at 6 weeks, and at 6 months again. This is going to be done as long as you're breastfeeding. If you're continuing to breastfeed even after 6 months, after you have started introducing your food, your solids, it's still okay. The baby is going to be done the PCR again, even up to 18 months, and then at 2 years you start doing the ELISA to make sure that the baby does not have the HIV. So it's not like when you say you're going to breastfeed even if you're HIV positive and then we give baby prophylaxis, it's just going to end there. No, we're going to continue to monitor the baby and making sure that you also know, you are also sure that the baby is not affected. Then it will save your baby all these illnesses that are caused by overfeeding and the infections that are making your baby the lack of remember, their immune system is weak because they are still babies. So if ever you give breast milk, you pass those antibodies that are going to make them stronger, and then they gain good immune system, they are able to fight infections. Whereas if you don't breastfeed, they are going to depend solely on their natural immune system, which is not that strong at that age, and then they are prone to infections. So breastfeeding, good people, is very important. It saves our babies. It's cheap, it's affordable, it's accessible, and it's very good at a good temperature that is good for the baby. Is easily accessible everywhere, anywhere you are able to take out and feed your baby. You prevent our babies from getting sick and getting admissions. It's very nice to stay with the baby at home. I'm a mommy as well. It's not a good thing to be in and out of the hospital with the baby. We all want to stay at home with our babies. So please, let's prevent this necrotizing enterocolitis by making sure that we attend our antenatal regularly from early, as we know that we have missed the period, and then up to when we deliver. Then you won't have problems. And if they do arise beyond your measures, they are definitely going to be attended to immediately, and then they don't affect your baby. And then make sure that you do as I have advised earlier on. If you watch my previous video, say please make sure that you look at your diet. You eat a balanced diet that has your fruit, veggies, proteins, and small amount of fat and carbohydrates, but making sure that you get enough nutrients from those. And then you drink lots of fluids. I'm not saying water, I'm not making that mistake. I'm saying fluids, because fluids is not only water. Remember, as much as water is said to be healthy, if you drink only water, a lot of water, you are going to flush your electrolytes. You start developing what we call hyponatremic dehydration. Or rather, even if you're not yet dehydrated, but you're going to be hyponatremic, that is also a problem. So you don't want to fix a problem with creating another problem. So please balance your fluids. You drink your juices, you drink water, you drink your cup of tea. Don't drink a lot of tea and coffee, because if it's too much, it's going to hinder the absorption of the iron that you need to bring to build your red cells, and then you prevent anemia. So as much as you can drink your coffee and tea, drink it with limit. Most importantly, you drink your juices, you drink your water, and then you are fine. You get enough rest, you don't put the baby under pressure, and then you got all the things that you want for your baby. We are happy, the baby is happy. Thank you.